Hello. Hello. Good morning, good afternoon, good evening to everybody. I don't know where everybody's joining. So sorry for the slight delay in start, technical issue. But here we are. So let's get right to it. I will introduce myself. My name is Nahw Ng, and I am your host for today. And today is going to be a wonderful session of we have amazing speakers lined up, and we're going to and we also have some creativity as well. So just tune in as you already are. Thank you for showing up, and be expectant. Get your biros, your notepads, because it's also going to be something to learn. So without much more time delay, I want to introduce our chair, the chair of the National Arts in Health Week, Oyindamola Fakeye. So I want to read her bio now. Oyindamola Fakeye is an experiential art curator and learning and participation producer, working to facilitate contemporary art workshops, events, and exhibitions. She is current executive and artistic director of the Center for Contemporary Art Lagos, CCA Lagos, where she previously co-founded the Video Art Network Lagos, alongside artists Jude Anogwi and Emeka Obo. Oyindamola sits on the board of the Arts in Medicine Project and is Director of Special Projects for the Arts in Medicine Fellowship. Oyindamola has curated various exhibitions and projects, including the 2019 Lagos Biennial, How to Build a Lagoon with Just a Bottle of Wine. That sounds so interesting. She consults within the art and tech space and was an associate arts consultant with the British Council, supporting digital collaboration, creative entrepreneurship, and new narratives. So over to you, Oyindamola.
Thank you so much. It's really, really exciting to be opening the National Arts in Health Week. I can see, sorry, I see that there's a little bit of a glitch. Apologies, internet. But it's really nice to be opening the National Arts in Health Week. Kicks off today, the 8th of May, and it's running all the way through to the 14th of May. It's been a wonderful experience working with a mix of artists, healthcare professionals, those in civic society to bring this event to you. And I'm also excited about this year's theme, which is Art for Health and Wellbeing, strengthening, which is around unity. And for us, I think being able to talk about strengthening our communities and thinking through about unity is very important to how we think through healthy living, well-being, and health promotion as at large. I think over the past 3 years, I think in COVID, we really realized the role that community plays in our health and well-being, and how having that challenged can significantly reduce our states of health. This specific Arts and Health Week will also be highlighting social prescribing, which is being rolled out in many nations across the world. And so we're excited to be part of that initial rollout within Nigeria. Social prescribing involving healthcare providers working with non-clinical interventions such as art-based activities to help people manage a range of their health and social issues. I think as Nigerians, and I say this when thinking about Lagos specifically, we are very, very social beings. And thinking about the unifying the arts and society, I think about Owambe culture, which is, although originally Yoruba culture, it is much about socializing, it's about music, it's about dance, it's about being together. And so I feel it's something that's very intrinsic and very embodied in the way we do life. So I'm interested in us, learning more around social prescribing this afternoon and throughout the week. I think for most people, we understand that the arts have the ability to address and shape how we feel and our well-being, but the arts also has the ability to address health inequalities and to support the most vulnerable in our societies. We are experiencing quite a large amount of brain drain, especially as it relates to healthcare providers. We're losing much of our healthcare, many of our healthcare providers. And so that leaves a lot of us without access to quality medical care. And so where we're seeing these gaps in our healthcare system, I believe that socially we need to strengthen our ability to cope, our ability to heal, and put back the power for health and well-being into not just our own hands, but our hands intertwined, because as a species, we are not individual, we are not independent, we are interdependent. And I hope that that comes through the programs that we're running this week. We will be partnering with a host of organizations who themselves are specialists in a variety of areas that overlap within the arts and healthcare space. We're fortunate that this partnership, we have a wonderful partnership with the WHO, the World Health Organization, and the Jamil Art and Health space as well, based in New York. I hope that many of you will be joining us for the conference on Thursday, which will highlight a variety of sector-specific actors, and will give a cross-sector introduction, conversation around arts and health, from education, health perspective, the arts perspective, the cultural institution perspective, and also the government perspective, which we believe is important. For us to really have the impact we want, we must be working across sectors and large sectors that deal with the majority of people. And so it's important that we are working with the government as well to deliver that. I want to end really just focusing on something that in conversation that that came up this afternoon when speaking with Christopher Bailey, who is the Arts and Health lead, and it was a quote by Carl Jung, in which he says, loneliness does not come from having no people about one, but from being unable to communicate the things that seem important to oneself, or from holding certain views which others find inadmissible. I think that a lot of us are dealing with certain life, life happens. So things have happened to us in life that maybe we didn't have the words at the time or don't currently have the words. But I believe that arts has the ability to allow us to move through our issues and move through certain circumstances when we don't have the words. So whether that's through dance or through drawing or painting or through music, the arts really opens up our communications, and I think gives us an outlet for us to experience and to move into healing and wholeness and health. I want to just use this opportunity just to thank everybody who's come alongside us to deliver on this project. So let me make sure I want to make sure that I don't leave anybody out when I say thank you. But definitely, again, thank you to the World Health Organization, to Arts in Medicine, the fellowship and the projects that been very, very instrumental in this Health Week taking place. Big thank you to the Global Social Prescribing Alliance, who you'll be hearing from later today, the National Academy for Social Prescribing, the Art of Healing, the Center for Contemporary Arts, the Lagos, the Sickle Cell Foundation, Guest Artists Foundation, the Children's Art Gallery, Open Mind Project, and the Federal Ministry of Health. So I'm going to pass it back to our amazing anchor, and looking forward to experiencing this week with you all.
Thank you so much. Thank you so much. That was wonderful. I really loved listening to what you had to say, and it's very interesting that we are in this space here today. Thank you so much for your message to us. And so moving along quickly, we have a spoken word presentation by none other than a formidable lady herself called Okunri Meta. I want to read the bio that I have here. So Okunri Meta, I'm sorry for those that are Yoruba, I'm not pronouncing it right, but her real name is Toyin Adeshola, and she's a visual and digital artist focusing on abstract and mixed media works in the social impact space. Okunri Meta, translated in Yoruba as Three Men, was a nickname given to Toyin by her dad, reflecting the strength and tenacity she lived by. Her passion for creativity and storytelling is what drives her. Not defined by her circumstances, she uses her art to tell stories of faith, resilience, and hope. In her words, art is a way for her to express herself and to have a voice. It speaks, it heals, and it tells a story. Due to traumatic experience living with a chronic illness like sickle cell disorder, she was introduced to the world of art and painting, where she found the impact of arts in therapy to find purpose and healing. She shares her expression in all facets of art, as reflected in her various works. Toyin works in the social impact space, is an author, sickle cell warrior, and advocate. And with much honor, I introduce you to Okunri Meta.
Thank you. Thank you very much, Shika. Thank you. Good afternoon, everybody. I shall be taking two poems, and my first is titled, I Am a Warrior. I am a warrior, proud and sure. I am a warrior, waiting at the door. I am a warrior, also sore, praying that one day the battle will be won. I am a warrior, battling every crisis. I am a warrior, just looking for solace. But my pain is not just on the surface. And I pray, yes, I pray one day the battle will be won. I am a warrior. Yes, I am. I am a warrior. Can you not tell? See my battle scars, the losses and the victories. I am a warrior because I live with sickle cell disease. Okay. The next one, final one, is called My Faith Shall Stand. Lord, I am alone. because in the pain I've found, no one knows the sorrows abound. Yet I'm in the storms and the desert sand, my feet shall stand. Aduro tinijo lojo isoro, the one who stands by me in crisis. Even though I'm not in Asokoro, my praise always rises. So while I still await my promised land, my faith shall stand. Bani Tosoya, you take away my fire. Yes, you still they bless me, even though things are not stress-free. And though I never understand, my faith shall stand. So let us praise Papa God through trials and troubles may flood. Only iretiwa, our hope for years to come. So even if it seems like no one, no man, or we are in no man's land, our faith shall surely stand. Thank you.
Thank you so much, Toyin. Please, can we just show some emojis of love for that word? She has poured out her heart in this spoken word, in these poems, and some love emojis. Yes, let's populate the chat with love emojis. Thank you so much, Toyin. Thank you very much. So moving right on, I have the pleasure of introducing a formidable man himself. And he's our keynote speaker for today. And he's going to be talking about social prescribing. None other than Dr. Bogdan, I'm so sorry, Shiva Gurkha. So he's the development lead, Global Social Prescribing Alliance, clinical champion lead, National Academy of Social Prescribing. Let me read you his bio. Dr. Bogdan is the founder and chair of the NHS Social Prescribing Champion Scheme 2016 to 2022, consisting of thousands of UK junior doctors and medical students. Over a 5-year period, the scheme has delivered over 700 teaching sessions in all UK medical schools, as well as developing a national consensus for teaching social prescribing. As the founder of the Social Prescribing Day, and that's a hashtag campaign, Dr. Gurkha, I hope I'm pronouncing your name right, Gurkha, right? Okay, has acted as an international champion, raising awareness of the subject globally. His work has influenced national healthcare policy and has driven key changes within the medical school curriculum, contributing to several peer-reviewed publications and policy documents, including the NHS long-term plan, the personalized care model, GP partnership review, as well as authoring 3 books on medical education. He is currently working as a development lead for the Global Social Prescribing Alliance and clinical champion lead at the National Academy for Social Prescribing. He has completed clinical foundation training and is currently applying for specialty training, as well as continuing his work as a collaborator for the Harvard Global Health Institute. Please let us make a very, very warm welcome to Dr. Gurkha. Thank you so much for coming, and over to you for your keynote address.
Thank you so much. And oh, do I not wish to be in person with you all? I wish we could do this live in person, but I truly hope that next year round we can meet and gather in person and we could all fly over to celebrate. But first of all, a very happy National Arts and Health Week, and congratulations to all of you for raising the flag and paving the way forward with such a beautiful and heartwarming event. What an amazing spoken piece from Toyin. Thank you for restoring faith. And I will be using one of your segments later on in my talk because I thought it touched our hearts. And I think that speaks about the power of art, doesn't it? Art knows no language, knows no boundaries, knows no borders. It truly unites people across the world. As our host was just saying earlier, I am a clinical doctor. I work in emergency medicine currently, but I also work in policy. And the presentation today will be focusing on social prescribing. And it truly is about rethinking medicine as we know it, to go far beyond pills and procedures. We're going to be looking at the power of art in health, and we're also going to be looking at what social prescribing is, what it isn't, and what it can do to support people across the world. And I know we have the pleasure today of launching the social prescribing network in Nigeria, of which we are very, very proud and grateful for some truly inspirational people who are in the room today. Christopher from WHO, Kunle, of course, and of course, Jill Sonki and her team in the US as well. But without further ado, I want to make sure I leave some time for questions toward the end of the presentation. So I'm not going to bore you with too many details, but please do put your questions in the chat as we go along. I'm sure you'll have plenty, but this is what we'll cover today. We're roughly going to be talking a bit about the purpose behind social prescribing and the real need for it in 21st century care delivery. We're going to be looking and examining a bit the United Kingdom's model for social prescribing and its workforce in policy and delivery of the model as well. And then we're going to be talking a bit about clinician buy-in, because we know art and health are related, but there's been some resistance in the past from the clinicians. And so there's a question of how do we get clinicians a bit more involved in this movement? And then I'm going to be giving you a bit of a taste of what social prescribing looks like across the world in our Global Social Prescribing Alliance. Now, our first speaker of the day did mention a few of the problems that we're facing, not only within England, not only within the 4 nations across the UK, but across the Commonwealth and across the nations of the world. We are facing a shortage in clinicians. We will be 19 million staff short by 2030, which is frightening, certainly to a young doctor like myself. I'm frightened by the idea that we get to live longer, which should be celebrated, of course. We should all clap at the idea that we'll reach 80, 90, 100 years old, 110 years old, and so on and so forth. But what happens is that we get to collect and collate long-term chronic conditions, and we get to increase the number of patients that get to seek help from clinicians within the hospital environment. Our lovely speaker from the beginning of the talk also mentioned the increase in health inequalities. And I think that's something that I would like to emphasize today. The COVID-19 pandemic has been a bit of a simulation of what would happen if we increase the number of patients that quickly seek help from the healthcare system. And that simulation showed us that those who were living in the poorest and the lowest income communities, they were the ones who were most affected. Some shocking statistics from the UK are that 97% of the nurses who died during COVID-19 were from Black and ethnic minority groups. I'm also an ethnic minority. I'm from Romania originally, and that is shocking to me. 98% of the doctors who died from COVID-19 were also from Black and ethnic minority groups. And that's in England. And that's a shocking statistics that just puts into the balance the idea of health inequalities. Health inequalities were always there. We knew they were existing, but COVID-19 was the simulation that we needed to prove to us the outcomes for those who live in the most impoverished areas and how we can help them. There's also some other problems that we're seeing in England and also across the world, really. It's on the rise. I've heard from colleagues in Nigeria, my clinical friends in there. In the UK alone, 1 in 4 of my appointments as a doctor are for pure social reasons. We're not adding the mental health into the equation here, because if we did, we would jump over two-thirds, I would say, of the appointments. So 1 in 4 people who come to seek help in hospitals or in a general practice in primary care, they would do so for pure social reasons. And that's very important statistics from England. Another statistics for you is that when I'm in emergency medicine and I'm on nights or on day shifts, 1 in 4, so 25% of the individuals there would be admitted for side effects from medication that we have prescribed for them. There was a recent report that showed that around 15 to 20%, so almost 1 in 5 of all the pills that we prescribe as medics and as doctors should have never been prescribed in the first place round. And so we are causing harm with some of the medication instead of using physical activity, and instead of using art therapy, instead of using all of the other evidence-based tools that are available to us. And this is a true real story, just to emphasize what social prescribing is. This is a 6-year-old boy that I met in the emergency department. I won't tell you his name, but we'll call him Timmy for the purposes of the presentation. Now, Timmy came to us several times, and we had to increase the inhaler dose multiple times and increase it to the maximum level that we could do so for his age group. We were constantly asking ourselves, what's the matter with Timmy? What's the diagnosis that this kid has come to us? Because he seems to be going back home and we seem to not have any effect with the asthma medication. We kept on prescribing more and more and more until we reached dangerous limits of the medication. And he kept coming back, and we kept on asking, what's the matter? What's the diagnosis? What's the matter with Timmy? Why are we asking that question? Because truthfully, that's how we've been taught in university, at medical school, throughout life. We are taught that health in general is based on the hundreds of arteries, thousands of muscles in the human body and the bones that we have. We know how to name each of those muscles and we know what the diagnosis is, but when we have to ask ourselves questions about someone's social circumstances, loneliness, social connection, or the way they live, our algorithms that we get taught in university fail us. So we get taught that if high blood pressure, let's give a medication for high blood pressure. If diabetes, let's give insulin, let's give a medication for high blood sugar, right? If loneliness, I'm not too sure. I wasn't taught that in medical school. If depressed, if mental health problems, what pills can we prescribe? And so our algorithms fail us in certain circumstances. And so in the boy's case, what we found out when we truly listened and we asked ourselves the right question, when we moved the emphasis from what's the matter, what's the diagnosis, to what truly matters to, when we asked them what their family situation was, what their living conditions were, this is what we found. And this is a picture from Timmy's house. We were prescribing medications, but Timmy was going back home to his house, which was filled with mold on the walls. So no matter how much medication I would possibly prescribe as a doctor, the allergen, the issue was social. Unless we dealt with his housing situation, we would not be able to deal with his asthma and keep it in control. And that's the difference between asking what's the diagnosis and the difference between asking what truly matters to the individual and their home. Because ultimately, we are sending people back home to what makes them sick in the first place. And medicine will fail us nevertheless. And you see, over the century, over the years, medicine has become this sad place whereby we confuse the word health with the word healthcare. Healthcare is the institutionalized model of health, right? We can think about healthcare in terms of repairing what's already broken. When I'm in the emergency department, I see a revolving door of patients that come in and out. They come in, they come out. I get paid for treating illness, for repairing people, but I don't get paid for preventing ill health. When we talk about the idea of prevention, instantly in people's minds are screening programs and prevention programs such as vaccination programs. But we never talk about the concept of health creation, actively working within our local communities to generate and create health when we're able to as well. So the essence of why social prescribing is needed is this. Healthcare does not start in hospitals, far from it. Health starts within our homes and in our local communities. It starts with you. It starts with us, each and every single one of us. We've developed a culture whereby we placed doctors in white coats with pens lined up down their pockets, telling people what to do, which is very wrong, because that is only going to exacerbate this fix shop and repair model that health has become for us. And so it's time to move away from this sick care model and move towards the idea of community health and how we as people can use the arts, music, culture, museums, and everything that surrounds us. It's time to go back in time to times when we used to know our neighbors, when we used to knock on their door and support them and help them when they were in need, and not the artificial, westernized way in which we've developed our communities more recently, sadly. And so this is how the story of social prescribing began in England. And in 2019, those problems that we were talking about just now, the workforce pressures, we were running out of doctors, and we needed to find a new solution that will develop a service model for the 21st century. And the whole emphasis was put on the idea that we'll redesign a service to reduce the pressure on emergency hospital services and that it will be more personalized. So the idea that one size does not fit all, that each of us are unique in the same way that you have drugs that target the therapy, you would have medicine that targets the personalized needs of the individual. So what does personalized care really mean? Well, actually, it really starts, and it means that it starts with this simple question. It's all about what matters to you, the individual. What is it that matters to you in that circumstance? And with that question, we are able to work together in partnership, share the decision-making process together with the individual and with the patient to design and co-design, co-create a new plan for their care. And so the NHS, the National Healthcare System in the UK, decided to invest and build a new model and put some funding towards this idea of social prescribing, which I'll explain to you in a second. So there was a big investment into a new role. Imagine this role called social prescriber. Imagine them being a nurse or a physiotherapist or an occupational therapist. It's a completely new role that gives us a bit of capacity in the healthcare system. And they were aiming for 1,000 social prescriber jobs initially. And I'll tell you how that's gone over the years, ever since 2019. And I've been privileged enough and had the pleasure to be part of the team launching the model. This is what social prescribing looks like. It's for all ages. It's not necessarily for old people, but this is a picture from the World Health Organization, from our colleagues in the Western Pacific region. And we developed a toolkit on how to build social prescribing in your own country. So social prescribing starts with the individual who seeks care from the medical doctor. It doesn't have to, referral can be from anywhere, but usually people come to seek medical help even though they might have a social problem. I'll give you an example. Someone might come in with a heart attack, but they might also be lonely. People don't come in lonely or with a heart attack. They usually come in with a heart attack, and you also find out that they are lonely and that they could benefit from art or culture or other activities within the local community. Now, the doctor, the clinical doctor, assesses the patient, and for any individual who does not have a biomedical problem, so let's say their problem is not biomedical in nature, if it's social or psychological, they are able to refer the patient further if they have, for example, if they are lonely, or if they are low in mood, or maybe they have financial problems, or maybe they have trouble sleeping, different elements that may not be biomedical in nature, they are able to refer to what we call a social prescribing link worker. Why called link worker? Because they link the patient to the local community groups. There's better names for them in the US. In Canada, community connector is a much better name for it. In the UK, we call them link worker. And so what the link worker does in essence is that they work with the patient, and they meet the patient and they give them the biggest resource of all times, right? Something I would never be able to give them as a clinician. They give them time. I only have 10 minutes with a patient in the UK, in England, right? The link worker has 1 hour with each patient, 1 hour to dig deep to understand what truly matters to them, what their problem is, and how they can help, and to be able to map out some of the problems and some of the issues, draw relationships between them, use motivational interviewing and coaching with the patient, and then they're able to create the prescription that's based on their true needs and refer them to the local community. So in this case, maybe it's someone who's lost their husband, maybe it's a widow, maybe she was lonely, but also having headaches, maybe nausea and vomiting. And so she would be taken care of from a biomedical perspective by the doctors, but we would realize there's something else there that's needed that she can get from the local community. And so she would be referred for an art on prescription program in the local community. And the community and voluntary sector is crucial here. And the follow-up is done again with a link worker in the local community in there as well. Now, in terms of social prescribing and arts in general, we'll talk more about this. And I know we have some experts in the room on the topic, so they, I'm sure, will send you some more evidence on the field. But these are just some pilots that you can read about online. But in England alone, in Gloucestershire, there's been for the programs using art on prescription, there's been a 37% drop in general practice consultations. So doctor appointments in primary care dropped by 37% in those regions where art on prescription was used, and hospital admission rates were reduced by 27%. And that's the power of art. And in terms of politics, and if we had people who really wanted to know the value of this as well, for every pound invested, for us, it ranged between an investment back of £4 to £11. We know the numbers are important, especially for politicians and making the case. And so we always have to include those too. But in terms of what people got, they got increased self-esteem, increased confidence, sense of belonging, and several other elements in there as well. And there's a fantastic interview that I recommend to people to watch. And I'll send some resources post-presentation as well in there too. Now, this talks a bit about where we are from a policy perspective in England at the moment. So the social prescribing link worker, the job that was created, is at the core of all of this. What social prescribing isn't is not just telling people to go gardening, to go singing, to go exercise. It's not that. I've been doing that for many years as a doctor, and it never works. Do people like being told what to do? We know they don't. In fact, they will never do it and they hate it. Some will because they have the education required, but those most affected by health inequalities will not even think about museums, will not even think about art. And so they need an extra hand. They need that extra support to work together with this individual, the social prescribing link worker, and the link worker may sometimes even spend more than an hour with them, because they need to build a rapport. So we've had cases in which the social prescriber and the patient would spend 1, 2, 3, 4, 5 hours until they would be referred to arts on prescription or to local community activities. That rapport building is very important. And so social prescribing is not mere signposting to an activity. The intervention is also very important. And the intervention is the moment in which the social prescriber sits down and co-designs and co-creates a plan with the patient themselves. And that's very important. So in terms of how we've done in England so far, we are by no means the perfect example. I always make this joke, but I always say we don't have the best fish and chips in the world. We love learning from other countries around the world. This is our model and the way we've done it, but it can be adapted. And we hope to help Nigerian colleagues to put this into practice. But from 1,000 link workers, the social prescribers, we currently have in England 3,400 social prescribers that have been hired as part of the national healthcare system. That is one for each general practice in England. So the whole country across England has one of those individuals that's able to prescribe more than pills, more than just procedures that we always put patients at risk with as well. Now, that's not to say that if you have pneumonia or if you have an infection, I'm not going to get you to go sing. You know, if you have pneumonia, I'm going to prescribe antibiotics. That's all fine. But people come in with pneumonia and loneliness and social isolation. We know they don't come with one or the other. And so it's very important to complement medication with evidence-based interventions, such as art on prescription as well. The way it works in England is that we have a national funding pot. It's universal coverage. It's free for all to use. So it's completely free as part of the government. The funding comes from the Department of Health and Social Care at national level, but the recruitment is done locally. And that's very important for health inequality reasons, especially. We always recruit locally because the local demographic is very important. We want to make sure the local people associate themselves with the local social prescribing link workers. That's very, very important from a community perspective. And there's a few national training standards, but once again, the training is also done locally. So the question is, does it actually work? Now, 4 or 5 years on, since 2019, 4 years, does it actually work? And this is a study that was done as an estimation by the London School of Economics and a few other leading universities in the UK. And we've shown that social prescribing link worker program saves up to 4.5 million appointments with GPs every single year. And to put it in perspective, that's a return of investment of £275 million for the English government. And just to give you an estimation of the cost of the investment initially, the program costed £200 million. So in effect, you're not only reducing the appointments, you're not reducing the pressure on GPs only, you're also getting around 70, 80 million pounds to reinvest back into prevention and into the healthcare system. And those are just appointments in primary care, not mentioning emergency care appointments, not mentioning the benefit that the patient gets, but politicians especially love these statistics because it means their investment is worth the penny that they put into it. And so moving on to who delivers social prescribing, as you can imagine, communities and the voluntary sector is absolutely crucial here. We are not saying we are using the local voluntary sector. It would be a shame to say that. If we want to make the most of the communities and the local voluntary sector, we need to fund those sectors appropriately. So it's very important, and we've been working with the local government, with different charities and national organizations to create central pots from which you could fund volunteering organizations and community service to ensure the activities such as museums, art on prescription, and gardening and all the rest are able to be delivered for the individuals, because we may be running out of those activities if those are underfunded and underserviced. So that's very, very important. And for those of you from the voluntary sector and community service field, I'd encourage you, or also for academics in the field, I'd encourage you to read this report. You'll find it on our website. But this was a micro grant program, small grants for 36 projects, 1.8 million pounds in total, but they were spread across the country, and especially for the communities that were most affected by health inequalities. And the findings are absolutely brilliant because it shows what £50,000 to secure transport maybe for the patients, or maybe parking spaces for the patients, or maybe someone who could deliver the activities. Those projects had a huge impact and return on investment for the individuals as well. And in the interest of sharing learning, for any voluntary organizations and community groups, we've established a network of over 9,000 community groups across the world who are trying to twin with one another as a bit of a system to learn from one another and use it as a mechanism to share learning across the world. So you can find out more on the website on that as well. Moving on very swiftly to people like myself, clinicians who are a very special breed and sometimes don't like listening to new things, especially when our training has told us to tell people what to do and has positioned ourselves in hospitals as experts of the field, which is by all means very wrong as a concept. So when you ask doctors what they think about this idea of social prescribing, When you ask them what the biggest barrier is to delivering this model of personalized care, they will say, of course, as you can see in this picture, they will immediately jump and say, yes, but we don't have time. We are so short on time during our clinical appointments that we are unable to use those innovative models because we don't have time to do so. Well, we would always challenge our colleagues and say that that's false. In fact, the biggest barrier is actually education amongst clinicians, amongst training physicians, students, and trainees who are just becoming doctors, who are able to understand the value of investing a bit of upfront time in this subject. So if you invest 5 extra minutes to make the referral for the individual, you will see that you get back maybe 10 appointments over the year that they would have come back to you for social isolation, loneliness problems, mental health problems, and you would have had to sort them in the end as well. So what's very interesting is a survey that we've done for general practitioners, so the primary care physicians in England, and this was a survey done by the Royal College of GPs in England, and it's fascinating because 59% of GPs, when asked, the question was, do you feel social prescribing reduces your workload? And 59% of GPs said yes, but we weren't interested in them. I was very interested about those individuals who disagreed and said it does not reduce their workload. What's fascinating is if you look at those statistics even further, you'll find that 98% of those 41 have never been trained on social prescribing or personalized care. And the follow-up question was also to describe what social prescribing is, and 62% of them said they'd never heard of the concept. And 33% of them assumed social prescribing was just telling people to go gardening, to go singing, to go to museums, which is, as we said, completely wrong. So it's very interesting that once again, it's not time that fails us, it's our education on how to make the most of that time in the clinical encounter, so that if I'm in the emergency department and if I can refer an individual who's come in with something else than a biomedical problem, is not passing the ticking bomb to my other colleagues, it's really sorting the root cause of the problem to make sure we don't send people to what made them sick in the first place in the local community. And that's very, very important. We've done several other schemes for clinician buy-in. We've created what we call champion programs. So we created a social prescribing champion program with funding from the National Healthcare System. And this is to ensure we place some ambassadors, some champions, some clinicians who would advocate for this across the country. And there's now over 200 of them, and they've integrated this successfully within the workplace, and it's expanded significantly. We also do a lot of support for students, because I myself, maybe 11, 12 years ago, got involved in this movement as a simple student. I was a medical student, frustrated with the way in which we were being taught, because we were being taught to over-prescribe and over-medicalize individuals who had social and psychological problems. And so that cultural shift was very, very important to make. And we're now working with them. I'm a teaching fellow at Harvard Global Health Institute, and we have a few internships that we offer to students from all over the world. And we'd love, of course, to see how we can work with our colleagues in Nigeria to share and spread some of that learning to universities in Nigeria, to teach them whilst they're young. It's a terrible analogy, but I use this all the time. If you want to train a soldier, you have to train them when they're young. And that's the same with the medical students, with the university students who will be the future doctors of tomorrow. And I'm really proud to say that in the UK, across the 4 nations, social prescribing is at the core of the curriculum in all medical schools across the nation as well. And just my final slides to say that we've also developed the Global Social Prescribing Alliance. We had a lot of support from the World Health Organization in doing so. And we have a group of over 30 countries at the moment. And I'm really proud, actually, I'll let Kunle do the honors later, but I'm really proud to say that we're going to be supporting Nigeria as well. And we look forward to helping you as much as we can. There are 6 weekly community of practice calls that you can all join and share learning with countries from all over the world to see how they've we've implemented this concept of social prescribing themselves. It looks very different in different countries, and we've had the pleasure of receiving a few delegations, including from Nigeria, from the chair of the what would be the healthcare system in there as well as ministers in Japan, and having the opportunity to present on a larger scale at the Economic Forum in Davos as well. Here are a few resources for you to take away. Definitely the WHO toolkit on social prescribing, which we've developed in collaboration with our Western Pacific colleagues and the World Health Organization. There's a fantastic paper from some of our US colleagues and colleagues across the world, and a few other booklets that you will find that I'm sure Kunle can share with the audience at the end of the talk as well to find out more. Probably the cherry on top that I'll leave you with as well is our Global Social Prescribing Map. And this was a product that we developed in collaboration, again, with the World Health Organization colleagues. And this is a map across the world of what social prescribing looks like in 25 different countries. You have the countries in here. You can download it. It's absolutely free, of course. And you can read about social prescribing models and healthcare systems across the globe to get inspired and see how it can work in Nigeria as well. The link worker model, as I mentioned, the social prescriber, as we call them in the UK, as I said, have different names across the country. They are ASHA workers in India, they are Shirikatsushian in Japan, they have different names across the world. The only difference being whether they're set up in healthcare, in hospitals, general practice, or whether people have decided to put them in municipalities at the community level. So to separate it a bit from healthcare. So that's an interesting contrast in there to keep in mind as well. And can I move on to the next one as well? And some other resources that once again, I'll share with everybody, but do get in touch. And if you're ever in London, we would love to take you on a few site visits to see social prescribing on the ground, to see how it really happens, to see some of the activities and the art exhibitions that are being developed. We led an exhibition called Art by Post, where we sent art kits to people across the nation during COVID-19 to prevent isolation and loneliness. And there's various other examples. My two final slides are just to leave you with a very thoughtful, just some food for thought, I guess. When you see this picture, what do you think of? And when I say the word health, what do you all think of? Because sadly, in social experiments across the years, when you ask people what they think when you say the word health, sadly, they think about pills, they think about procedures, they think about doctor, nurse, they think about healthcare professionals. But you will know, and as I've seen on this chat already, that health goes beyond pills and procedures. We shouldn't confuse health with healthcare. We should talk more about health creation, and we should go back to the 1948 definition from the World Health Organization that says that health is not the mere absence of disease, it's more than that. It's a complete physical, social, psychological well-being state. And health happens in our local communities, it happens at home, it happens with all of you, and we look forward to supporting you in your amazing journey. Nigeria has some beautiful communities all working together for one another, and I think you can all build on that, and we'd love to support with resources and as much as we can. Thank you so much for your attention, and I hope it's been enjoyable.
Enjoyable is an understatement, Dr. Gurka. Honestly, I learned so much. This was such a wonderful keynote address. I'm excited about this coming here. And I have written down quite a number of things. It's very interesting when you mentioned the mold. It's something that we actually go, because we're a very high humid climate here, we actually have houses that are moldy, just as bad as that picture that you showed. And we don't really realize that the mold, it's actually a very deadly phenomenon, right? You just have mold in your bathrooms, mold in your kitchen, and it's just like you think you can paint it over, but you can't. And then about the reduction of this social prescribing, the percentages were amazing. I mean, it's getting something. Yeah, 37 and 27. And the last takeaway, I mean, there were so many takeaways, was to start them young, which is true. I think really to train them, the present medical doctors, physicians, everybody, it's good to start there. So I just want to thank you so very much for this wonderful. I know that perhaps we'll have a time for a few questions later on, but for now, I just want to thank you so much. Thank you.
Thank you very much, and to your listeners as well. And please do get in touch if I can be of any help at all.
Yes, sir. Yes, thank you so much. And so moving along, that was just very, very interesting, the work that you're doing and the communities as well, using communities. So I want to introduce our next speaker. He's already eager and smiling. None other than Mr. Kunle Adewale himself. A lot of us here know who he is. And he's the founder, the Arts in Medicine Project, and member of the steering committee for the WHO Jamil Arts in Health Lab. And I'd love to read his very formidable, this is very condensed, a very condensed bio that we have here. Kunle Adewale is an artist and a development practitioner by profession. He is a graduate of Fine and Applied Arts, Painting and Art History from the Obafemi Awolowo University, Ile-Ife in Nigeria. To hone his skills in leadership, he studied civic leadership at Tulane University in New Orleans. With over a decade of experience as an artist and educationist, Kunle founded Tender Arts Nigeria in 2013, a social enterprise and non-profit making organization which positively impacts children, youth, and adult populations with a focus on therapeutic arts, art education, talent development, community development, and civic engagement. With his organization, he carried out several Arts in Medicine projects, AIMP, as program director in over 9 states in Nigeria, covering Southwest, East, and Northern parts of Nigeria, other African countries such as Tanzania, Namibia, Sierra Leone, Liberia, Ethiopia, Kenya, South Africa, and India. He started these projects in 2016 to help transform the healthcare experience for patients, their family members, and caregivers by incorporating arts, paintings, drawings, mixed media, expressive writing, poetry, installation of artworks and crafts in healthcare experience. In the year 2015 to 2017, Kunle also served as the International Program Director of the ICEHA Healing Through Arts project for survivors of Boko Haram insurgency and their families in the northeast of Nigeria. This is the list of his bio, and with much honor and much happiness, I introduce you to Mr. Kunle Adewale himself.
Thank you so much, Auntie Yinka, for that wonderful introduction. Deeply appreciate you. Again, I want to say a very big thank you to a wonderful friend, Dr. Bogdan. I know about some weeks back, we had an incredible conversation, and it's been a wonderful, rewarding connection with you on this side of the world. And again, congratulations to all the great team back home in Nigeria. Sorry I couldn't join you because the work must continue. Well done to all of you. And I'm very kind of excited and proud that we are launching the social prescribing network in Nigeria. Before I proceed, I would love to play a video, and then I will just speak very briefly. I'm not going to take our time at all. Do this.
Tomorrow, my sister Fashiya sorrow. It's a cold, but trust me, I know. But I'm the king of the not just know. Open up your heart, open up your mind. Never let that leave me your mind. Free your mind, speak your mind. And if they hate, just don't you mind. I'm a superstar and I know that. I'm a superstar and I know that. Nobody can tell me what I am. I'm a superstar and I know that. I'm a superstar and I know that. I'm a superstar and I know that. Nobody talk too much. All I need is a pen to come up with a bunch. It's real music, and I'm trying to move it forward. I ain't trying to die young, no man know who drug or no. Keep my hand off till I arrive in the clouds. Let no one talk to them, just
I would love to tell us briefly about the video I just played now. I know I've shared this story with a few people, including Chris. In 2018, we had the privilege of visiting the Federal Neuropsychiatric Hospital in Nigeria, in Lagos, Nigeria, where we normally facilitate our art and health session. And then I was privileged to meet this young lady who was referred to our art program, and then she became part of the music session we had. And then after the music session, she walked up to me and she said, "Oh, Mr. Kunle, I would love to write a song to perform during the music for mental health within the mental health facility." I said, "Why not? Go ahead and write your music or write your song." And then prior to this time, she has been kind of very suicidal and she was going to kill herself. And then she found herself within this space. And then, you know, she wrote the song, and then the song was titled, "I Am a Superstar and I Know That." And today, you know, the concert was where you heard her performing, singing. So she was the one singing, she was the one rapping, and then you see the Art and Medicine Orchestra, you know, performing alongside with her. And before that particular day, you know, she was opportune to engage with the musicians, the professional musicians that came in from the community into the hospital, and then they got to rehearse together. And then, so that is why, you know, we had that quality of musical output from the session. Moving forward, this young lady today, she's out of the mental health facility at Yaba in Lagos, Nigeria. And not only that, being part of the music session she was referred to, today she went back to music school where she left the hospital. She graduated from the music school, and now she's performing music with other people in the community, including expatriates that come into Lagos, Nigeria. Not just only that, this young lady, in the long run, became part of the volunteers of the musicians in our program who goes to mental health spaces to, you know, host music session, to give back to the hospital space where she was once a patient, but now as a musician. It's incredible to see what social prescribing can do. It's incredible to see what the art can do. It's incredible to see the healing power of the art and how transformative the art can be when, you know, given and provided and made available, not just to the privileged few, but to all as much as possible. And then for us in Nigeria, it's a great news to see that social prescribing, you know, is going to become part of course, it's already on ground, but formally is going to be part of a strong development work, just like the way we started the Global Art and Medicine Fellowship Program way back in 2017. And then we started seeing medical doctors and medical students signing up to become part of the Art in Medicine Fellowship Network. And then it's very interesting to see how medical students goes to the hospital room to facilitate art session with patients, medical students of the Lagos University Teaching Hospital. And then this kind of engagement or learning opportunity has never been in Nigerian medical, you know, curriculum, never, even up to now. And then to see that, you know, medical students and medical personnel who connect to a local resource such as the Global Art and Medicine Fellowship Program, and they can leverage the content, they can leverage the knowledge and the skills impacted on them to utilize, you know, in their future work. It's very inspirational to see that. And of course, with all that Dr. Bogdan shared today, you know, being a medical person and seeing all of the great work he's doing, and then I was kind of reflecting on the medical students who have been part of the, you know, Art in Medicine Fellowship Program, to see many of them whose parents or fathers are actually owners of big hospital or private hospital, and to see how they will now start thinking. For me, it's now more about rethinking health. You know, when Dr. Botgan said something about health, what comes to your mind? I mean, it wasn't wrong, right? We think about health, we think about pills, we think about, you know, medical procedures. These, I think, are things we have imbibed over the time. And then, but this is an opportunity for us to rethink health and engage creativity, rethink health and connect to community, rethink health and engage with programming that promotes well-being. Again, in the coming week, we hope to, we currently have, you know, a smaller group of medical students and also students from other, you know, discipline as well on a WhatsApp group already, who are like forming the, you know, student network of social prescribing in Nigeria. We also have a group of medical personnel as well on a WhatsApp group. And in the coming weeks, we are going to start our workshop and building, and some of the content that Dr. Bodgan shared with us today will be part of the resources that we are going to be sharing with them to be able to build a strong army that is rethinking health, army that is connecting community to well-being. Thank you so much, everyone.
Thank you so much, Mr. Kunle. Sorry, I'm experiencing some issues with my computer, but it's okay. As in, if I unmute myself, it takes a little bit of a while. Thank you, Mr. Kunle, for this. I'm personally excited for this social prescribing, because after you had mentioned it prior to today, I went and I have looked at what it's about, and it's actually exciting that it's coming to Nigeria. So yes, and I think a lot of us are inspired, obviously, by you always, and everything that we can do to give back, to heal, to transform somebody else's life. So thank you so much once again, Mr. Kunle, ever so eloquent. And yeah, so now we're going to move. We have been sitting down for quite a while, haven't we? So now it's time for us to move. And we have in the house, Oyinkan Talabi. She's a wellness director of the Bodyworks Nigeria. And let me quickly just read her bio. Oyin, okay, she's called Oyin. Talabi is a Pilates teacher who has been
While waiting, she's Oyin's there, because I was quickly going to look out for you. Oyin Talabi is here, and then we're going to spotlight that to just go right away so that we can really save time. All right.
Awesome. Hello, everyone. And thank you for the warm invitation and welcome. So we'll just jump right in. So if you are sitting, I would invite you to please stand, come up onto your feet. And I want you to place your feet directly under your hips. So just feel your pubic bones over there and your feet directly under. If you're not able to see, if you're not able to stand, just sit up tall and have your spine stacked up through your shoulders. Okay, so now just rock gently back and forth. Very gently. This is a great way to center yourself. So you sort of spread your weight on your feet. So now you're going to breathe in through your nose and you're going to breathe out gently through your mouth. So you breathe in and you breathe out. So we're going to breathe in and we're going to come up onto our toes. Breathe in, come up. And then breathe out, come down gently, gently. Now roll back a little bit, lift your toes off the floor and spread your toes. Now breathe in, come back up, 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 reach up tall. And breathe out, come down gently. Let's do one more. Breathe in, up, 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 reach up tall. And then come out as you're breathing out. Spread your weight on your feet. Beautiful. So I'm going to show you a few movements that you can do during your day to release tension from your body. And also anytime that you're feeling stressed mentally, emotionally, these are great ways to release that pent-up emotion and energy. So once you're stacked up through your spine, I want you to bring your hands up and you just wiggle your fingers. Just wiggle your fingers. And as you're doing this, I want you to just feel whatever you're feeling, whatever sensations are going through your body. I want you to pay attention to it. So now as you wiggle your fingers, take a breath in and breathe out. Now we're going to breathe in as we bring our hands up and breathe out, come down. You're still wiggling your fingers. Breathe in, come up. And breathe out, bring it down. One more. Breathe in, bring your arms up, reaching up. And breathe out, bring it down. Now just release, bring your hands down. And I just want you to breathe. Feel whatever your body is feeling, whatever you're feeling through your shoulders. It's okay. Just breathe in. And as you breathe out, let out the tension. Breathe in. And breathe out. Let out whatever emotion. Beautiful. Okay, so now we're going to move inwards to our shoulders. Now I want you to just roll your shoulders gently. Rolling your shoulders. So it's almost like you're giving yourself a massage in your shoulders. Just ease out the tension. Don't move too hard. Just keep it soft, but feel it go deep. Now, very gently come to a stop. Go in the opposite direction. Rolling forward. Very gently. And then come to a stop. Bring both shoulders up and bring both shoulders down. Good stuff. And I just want you to stay here and breathe. Just breathe in through your nose gently. And breathe out. When you're breathing in, breathe in. Imagine you're breathing into a balloon. You're breathing in deep. You hold it, and then you breathe out. Okay, so now to open out your spine some more, you're going to imagine that you're drawing a C shape with your spine. So you're going to breathe in and curl your spine. It's almost like your forehead is coming to your belly button. And then you breathe out, you stand tall, move directly forward. You breathe in, curl your spine. And breathe out, stand up tall. Breathe in, curl your spine. This is an important movement to know. And breathe out for practice. Breathe in, curl and breathe out. We're going to add a little layer to this. We are going to breathe in, hold it here. Hold it here as you breathe out. Breathe in, think of the back of your rib cage. Just feel it expanding. And breathe out. You're still in this position. Breathe into your back. Breathe in deep. 1, 2, 3, 4, 5. And as you breathe out, stand up tall, looking directly forward. Beautiful. That's a great way to open your spine. Now, inhale, reach one hand up, and exhale, come into the side. Inhale, come back up, and exhale, bring that hand down. Other hand, inhale it up, into the side. Inhale, and bring it down. Let's do 2 more on both sides. Inhale, up, into the side. Inhale, and bring it down. 1 more. Inhale. Okay, sorry. On this side first. And come back up and bring it down. So now it's 1 more on both sides. Inhale up, into the side. Come back up and bring it down. 1 more. Inhale. I know it seems like I'm always saying 1 more. Into the side. Bring it back up and bring it down. Good stuff. Now bring your shoulders up again and your shoulders down. So this is a great way to align your shoulders and your spine. So now look over your right shoulder as far back as you can. Come back to center. Breathe in. Then breathe out. Look over your left shoulder and come back to center. Let's do that 1 more time. Breathe in. Look over your right shoulder. Come back to center. Look over your left shoulder and come back to center. Now bring your ear to your shoulder. Feel a stretch in the side of your neck and come back. Other side and come back. Let's do that again. Ear to shoulder. So your shoulders stay down and then you bring it back. Other side. So this is fantastic for all the texting and typing that we do. And bring it back. 1 more. Look over your shoulder. Sorry. Now we're looking over the shoulder. Hold it here. Bring your nose down towards your shoulder. And just hold it there for 5, 4, 3, 2, 1. Look back up and then come back to center. Then we go to the other side. You bring your nose down. 5, 4, 3, 2, 1. Look back up and then come back to center. We inhale back up onto our toes. And we exhale, we come down very, very gently. And I just want you to bring one hand to your chest. And just focus on your breath. Breathe in. And breathe out. As you're breathing in, I want you to think of one intention. What is that one intention for you for today, for this week, on this conference? Just think on that intention and breathe into it. Inhale. Hold your breath. Now exhale gently. Release any doubts, release any fears. Just holding on to your intention. Let's do 1 more. Breathe in. 1, 2, 3, 4, 5. Hold it. And let it out. Good stuff. Thank you very much. Thank you for having me. I hope that you feel lighter. Any feedback on that from the session? Who is quiet?
Thank you. Thank you so much.
Thank you, Onyeda. I said Onyeda, no.
Thank
like
you.
everywhere is
So
quiet,
if you
you
leave some comments, about what your experience was with the breath work and the movements.
Mindful movement.
Yeah,
yes.
Your mindfulness and the breath work and just generally the movement. Thank you so much. At least we all got off our seats. So moving on quickly, I want to introduce our next speaker, who is none other than Dr. David Fakunle. He's an assistant professor, public health program, Morgan State University, School of Community Health and Policy. Now, he has a very formidable bio. I'm not going to read all of it because of time.
Thank you.
Well, I'll try, but I know I'm a fast speaker, Dr. David, but let's start. I love how this is introduced. David Olawi Fakule, PhD, is a mercenary for change. He's a mercenary for change, employing any skills and occupying any space to help elevate everyone divested from their truest self, especially those who are Black, Indigenous, and people of color. David serves as Assistant Professor of Public Health at the Morgan State University of Public Health Policy, Adjunct Assistant Professor of the University of Florida Center for Arts in Medicine, and Associate Faculty in the Mental Health Department and John Hopkins Bloomberg School of Public Health. Wow. His interests include stressors within the built environment, societal manifestations of racism, and the use of art and culture to strengthen health, equity, and ultimately liberation. Additionally, David has applied artistic and cultural practices such as Black storytelling, African drumming, singing, and theater in the proclamation of truth for over 25 years, collaborating primarily with organizations in the Baltimore, Washington, D.C. region. Among many affiliations, David is co-founder and CEO of Discover Me, Recover Me, an organization that utilizes the African oral tradition to empower use of storytelling and healing and growth. Serves as executive director of Womb Work Productions, wow, a Baltimore-based social change performing arts company, and serves as chair of the Maryland Lynching Truth and Reconciliation Commission, the first state-level commission in the United States dedicated to chronicling and bringing justice to racial terror lynching. That's why I have to read it all. You're welcome to the program, Dr. Fakunle. Please take it away.
Thank you. It's an honor and a pleasure to be here. Let me pop up my screen real quick. So I do want to be mindful of time. I know we're running a little bit behind, and I can be very, very long-winded if you let my wife tell it. So I will do my best to honor the time that I do have here, but it truly is an honor to be in this space. So I'm gonna get right to it. Let me just show you these photos, and I show you these photos because at the end of the day, regardless of any accomplishments that I have, and you got the rundown of my bio, I'm a man that does his best to love the people who love me. And I am the proud son of Taiwo Olubenga Fakunle, who immigrated from Ibadan, Nigeria, to Alabama in 1981, eventually made his way to Morgan State University in Baltimore. And that is where he met my mother, and the rest is history. So I carry Nigerian blood with me everywhere. And it doesn't just show up in my beautiful skin. It doesn't just show up in my beautiful locks, but it shows up in the aspects of the culture that I carry with me. So African drumming, you see this gorgeous agbada that I'm wearing, right? and an Oba's crown. I am proud to be Nigerian, and I'm proud to bring these aspects of my culture everywhere that I go. It's all the story that I get to tell. So what I want you all to do right now as I'm sharing is just think of a story. Think of a story that perhaps made you happy, made you angry, perhaps it motivated you, made you think, but more than anything else is a story that you never forgot. And when I think of the stories that mean a lot to me in my life, I think of stories that were generated by the people that you see here. So to the left are my godparents, Dr. Joanne Martin and the late Dr. Elmer Martin, peace be upon him. And on the right, you see Mary Carter Smith. The National Great Blacks in Wax Museum, located in Baltimore, Maryland, about 10, 15 minutes away from where I'm talking to you right now, my home, was the cultural repository where I learned everything it was to be Black. One of the things that I have to acknowledge with you all is that there's a little bit of a context when it comes to being Black in the United States of America. You know, we got a history with that. So we have struggled overall with this sense of identity. Who are we? We know that we are descendants of the African diaspora, but a lot of times we don't know more than that. So for us, history is very critical. It is elemental to being our truest selves. And because of the National Great Blacks and Wax Museum, founded by my godparents, I grew up around that history and that culture. So no matter what the society of the United States wanted to tell me about being Black, I knew better. I knew my African roots. From Mary Carter Smith, I learned the art and science of Black storytelling. Mary Carter Smith is someone who traveled the world, especially the continent of Africa, learning stories, learning traditions, learning histories, and she brought that back to the United States, and she specifically brought that back to Baltimore, Maryland, where she was based for much of her incredible life. And that is where I met her, through the National Great Blacks and Wax Museum, and got to learn about stories and history and culture in another way. So because of these people that you see here, I am who I am. So if you are impressed by my resume, by my CV, you need to thank these people. Because of everything that I've accomplished in this world, I've done it with a sense of my Black self. I've done it with a sense of my African self. And it is because of them, it is because of my father, it is because of so many in my village that I am able to be in this space with you today, as whole as I tried to be. So my background, aside from arts and culture, is public health. You will get a textbook definition of public health from a lot of people, but I'm going to give you the real definition of public health. Public health is anything related to the acknowledgement, appreciation, understanding, and advancement of human health and well-being. So whether it's practice, research, education, activism, advocacy, and so many other things, built environment. So like you heard, one of my interests, even the way that our world is constructed in the man-made sense, the people person, or the people-made sense, that's public health. There is a connection to how we feel, physically, emotionally, spiritually, culturally, financially, economically. All these things are connected. So in public health, everything is involved. And that was such a perfect space for me as a researcher, as a scientist, to be in a place where everything goes. So let's kind of transition to that. Thank you, Catherine. I'm glad you like that definition, because it's a real definition, right? It's the one that makes the most sense and keeps it, to me, in the simplest form. Like, we overcomplicate a lot of things in my field of public health. I know this from firsthand experience. So any opportunity I get to just keep it simple, I'm gonna do that. So let's transition to arts and culture. Why does arts and culture work in health? Well, my Nigerians out there, y'all know this, because it does, right? It just does. And we don't necessarily need a paper. We don't necessarily need a conference or a presentation to know that. We just know, and this is a human thing too. Like, let me not even just, shout out my Nigerians, my Niger, right? All of us know this. You know what I mean? I'll give you the depth. So, Chime, I see your comment. What I'm going to do, and I do this with all my presentations, I'm going to give this presentation. So Kunle is going to get this, and I want Kunle to share this with everybody, because this is not proprietary information. This is just stuff that exists, and the best thing that I can do is share it with you all. So I'll give you that definition and then some. Like, that, you're welcome, you're welcome, you're welcome. Like, this is what I do. All right. So this is all for y'all, right? This is all for y'all. The way that we know that arts and culture works in health is because we experience it. So when I have my djembe, right, and I'm playing, I know it's good for me. When I'm on stage acting or singing or dancing, which I don't do as much anymore, I know it's good for me. When I'm telling stories, which is honestly what I'm doing right now, I know it makes me feel good. So we can rely and should rely primarily on what we as human beings experience when we are around arts and culture to know that we feel better. There are certainly ways that we can explore that deeply. Like we can explore that from a biological standpoint. We can we can explore that from a financial and economic standpoint. There are many ways that we can tell that arts and culture works. But the most important thing is, does it make you feel good? Are you happy when you do it? Because if you are, that's good health, right? In many cultures, right, especially the cultures of the African diaspora, we don't separate these notions of arts, culture, and health. It's all the same thing, right? So when you aren't feeling yourself, you go to the healers, right? You go to the griots, right? You go to cultural spaces and creative spaces to feel better. Doesn't mean you don't take your medicine, right? But part of that medicine, we talked about it, social prescribing, is also, you need to get on the djembe, right? You need to tell your story. You need to be around these creative energies to help you feel better. So for me, even though I'm a researcher, even though I'm an academic, my focus is always on doing it. So more people, fortunately, and that's the way I would want it, more people know me as someone who does public health than just researches and studies and teaches public health. That's the way that I want it. We also find the value in learning about the minutia, right? What are those intricacies and mechanisms that we get? So what is it about playing djembe, right? What is it about storytelling? So that's where the focus of many people who study arts, culture, and health is. It's a recognition that within the epics of public health, we are in that fifth wave, which is, what is it about us? What is it about the collection of human beings that we are around and the practices that define that particular group of human beings that relates to their health and well-being? So there's so much that we can explore and will explore and continue to explore when understanding just how impactful arts and culture is with health. But the fact of the matter is, it is impactful. That's the most important thing. So some of the ways that we have looked to understand that minutia is creating frameworks. In all honesty, we know that arts and culture really doesn't abide by rules. Like, it's not about rules, but we know that there are themes. We know that there are common denominators that we can explore and kind of understand within cultural and really creative expressions. So some of those things that we see is self-efficacy, right? We feel that we can do it, right? So I started drumming when I was 6 years old. I definitely didn't know what I was doing at 6 years old. Fast forward 30 years later, I definitely know what I'm doing when it comes to playing djembe. So that in itself is longitudinal self-efficacy, personal and cultural resonance. It feels good when we are ourselves. I feel like we all know that. This is not breaking news. When we can be genuine about who we are and what we want to express, it makes us feel good. Aesthetic experience. We like pretty things, right? So we love to see a beautiful sky, right? The sky here in Baltimore is fairly clear, cloudy, but not super cloudy, right? We love things that are pretty. That also makes us feel good. When we engage in arts and culture, it allows us to connect, emotional engagement and empathy. We get to be human when we are around arts and culture. When we get to share and be heard, that makes us feel good. Sometimes arts and culture is the only way we make sense of this thing called life, right? It's the only way that we can halfway begin to tell you what it means to live the life that we're living. And self-transcendence. So again, being the best version of ourselves. So through these mechanisms, we get these outcomes, right? We feel better. We can increase access to health services. We can be in spaces that allow us to be the best version of ourselves. We can support the necessary policies, big P and little p, that need to happen in order to create healthier communities. We can strengthen existing methodologies, right? The things that we're already doing can be done better, right? If we have that cultural context. And health communication. COVID-19 is a great example, right? So COVID-19 is something this whole world has had to experience. And one of the things that we saw was a shift in how we had to talk about COVID-19, because it wasn't just about wearing a mask. It wasn't just about, taking a vaccine, but you had to give people a real reason to care about this menace that was running roughshod over the entire world. So when you use creative energies to do that, it gives you a better way of connecting to human beings. We can be some stubborn somebodies, right? Okay, I've been around Nigerians for a long time. I love us, but we can be stubborn as hell, right? So it's important for us to find the ways that the story can resonate And sometimes, again, it takes the rhythm of a drum, right? Sometimes it takes the movement of dance. Sometimes it takes a painting. Sometimes it takes just a cultural expression, right? I gotta give a shout out to this piece. This is a piece from the Luba people of now Democratic Republic of Congo. This is arts and culture, right? So this in itself tells a story. And this used almost 200 years ago. I'm so grateful to have this in my possession for safekeeping. It's just a representation of how our art, our culture, right, our African culture is so much how we are defined. And there is something about that, right, being our true African selves that allows us to be in our best health. So my focus is storytelling. So why storytelling? Let me give y'all a quick rundown of why storytelling is what I tend to focus on. So Solomon Ibn Gabriel said, the first step in the acquisition of wisdom is silence. The second, listening. The third, memory. The fourth, practice. The fifth, teaching others. No matter where we are on this planet, be it the continent of Africa or anywhere in between, storytelling is universal. Every single manifestation of humanity on this planet does some form of storytelling. It's an art form and it's a science. When we tell our stories, whether we're using our voice or using any other form of creative expression, there's power behind that voice. Listening is just as important, if not more important, than telling the story. Because when you listen to the story, there's an acknowledgement of truth. You are recognizing that that person's story, that person's experience is what it is. You may not fully understand it. You may not even like it, but you acknowledge it. And a lot of times that's all people are looking for, is to be acknowledged. Ultimately, between storytelling and story listening, there's a mutually beneficial exchange. It's one of the few things in this world where everyone wins. But when there is genuine storytelling and genuine story listening, it helps everyone. So in my work in arts, culture, and health, I have focused on this notion of epistemic justice. And epistemic justice is an acknowledgement that so much of what we consider to be wisdom is defined by systems that many of us had nothing to do with. So again, I'm speaking in the context of the United States, but you're going to hear some very similar traits that I'm sure are applicable to wherever you are. In my field of public health, I know that what it was considered to be knowledge in public health was designed, implemented, really kind of just structured by wealthy, educated white men. Am I a white man to you? I don't think so. So I recognize that the knowledge that I represent, right, the knowledge of the African diaspora, the knowledge of the Yoruba people, doesn't really show up in public health. So there has to be pathways by which our understanding, our navigation of the world shows up in our space. And for me, storytelling is the easiest way to do that. So Discover Me, Recover Me is an organization that my mother and I started. It's been 6 years now officially, but we've been doing this for about a decade. And it is the intentional use of storytelling. Many of our stories come from the African oral tradition that we share in spaces of healing and recovery. We are all on the spectrum of trauma. We're all dealing with some stuff. In navigating that healing, telling your story is a critical part of that process. So a lot of times people just need a space to tell their story. They're not looking for advice. They're not necessarily looking for healing, necessarily looking for recovery. But when they get to share their story unimpeded, without any judgment, without any preconceived notions, the healing process is beginning. In research, story mapping is another way that I've been able to incorporate storytelling, genuine storytelling, in the understanding of public health, circumstances. So what you see on your right is a map of 3 neighborhoods in Baltimore, Southwest Baltimore, that are defined by a lot of health inequities and health inequalities, some of the worst in the state of Maryland where I live. And so in order to understand how to address those health disparities, rather than just kind of asking questions about the particular initiative that this was a part of, I decided to ask the participants, where are the places where you take care of your health and what are the stories behind them? So what you see here is a representation of the places in their neighborhoods that people took care of their health, physical health, mental health, emotional health, psychological health, financial health. And there was a story behind each and every marker that you see. So that is what I call story mapping, is also called qualitative GIS, geographic information systems. The common denominator between these two approaches is transformational grounded theory. It's simply a rejection, an outright rejection of, again, many of the approaches that have been used in particularly community-based participatory work, whether it's research or practice, because of those systems of oppression that you cannot ignore, right? I can't ignore that white men have dictated the field that I'm in. I'm not a white man. I'm going to reject a lot of their principles because they aren't applicable to me and they aren't applicable to the people that I serve. So it really is centering the people that you serve and saying, you tell me what needs to be done. It's so simple and yet so profound, right? And yet it's such a great strategy to use when it comes to being successful in public health. And I'm very fortunate that in the spaces where I've been able to use storytelling and really center the people, as is no surprise to me, it resonates and they respond with a lot of power and with a lot of wisdom, right? A lot of wisdom. So this is just one picture that kind of captures that essence. So this is the Existential Determinants of Health initiative that was started through Woundwork Productions, so the nonprofit in Baltimore that I lead as executive director. So these are a few of our participants in EDOH, as well as members of Woundwork. So Mama Rashida, Mama Kay, my mother in the middle, my wife in front of me. So it really is a family affair. It's something where we have brought together people who are driven by love, who are driven by a desire to truly help the people in the way that they needed to be helped, and to do it with the foundation of arts and culture. So while we are looking to focus on physical health, emotional health, spiritual health, economic health, arts and culture is the primary modality by which we do it. And the reason that EDOH and so many other of my efforts are the way they are is because, you know, those experiences with the Doctors Martin, Mama Mary, being in those cultural spaces where I knew the truth, I recognized the reality of the situation. Be it in the United States or anywhere around this world, we are dealing with significant inequities that show up every single day in every way you can imagine. So for me, the fight is not for equality, because equality would assume that everyone is on equal plane, but you can't ignore the history, right? You cannot ignore the history. My father is crazy. My father was born a few months before Nigeria gained independence, right? So even though he grew up primarily in a free Nigeria, you can't ignore the history of colonization, right? In Nigeria, it still has ramifications today. I can just talk to my cousins and they'll tell me all the mess that's going on in that country, right? Because of the ramifications of the history. So we can't ignore that stuff. So equality is not what I'm striving for. Even equity is not what I'm striving for, because yes, it does even the playing field, but yet you still see that fence that's in front of everybody. The one on the right is what I'm aiming for, liberation, right? I want my cousins, right? My cousin Dare, right? I got so many. I want them to live lives of their own determination. And it sucks. It sucks being in the US knowing that I can't help them as much as I want to, because there's so much that needs to be done in Nigeria and in so many other countries around the world. But we do the best we can so that we can create the spaces where they can live lives that they want to live. I want nothing more than for my family to have that, be it across the across the Atlantic Ocean or right here with me. So that is the point of all this. And for me, arts and culture, storytelling are the ways that we can push, right? And keep pushing and strive for what needs to be done. Those policies, those practices, those resources, those opportunities that truly allow for liberation. So this is why I use this proverb all the time. It's from Zimbabwe. I'm sure you've heard it. It's all over the place, right? Until the lion tells his side of the story, the tale of the hunt will always glorify the hunter. Is that not the story that so many of our people have? That's why storytelling is so important. That's why whatever opportunity we got to share our truth for however long we got. You've got to tell the story. And I also include this from the Reverend Dr. Martin Luther King Jr. Despite all the mess that I know we've dealt with, and it's a lot, I know the history, right? I've decided to stick with love because hate is too great a burden to bear. I get it. We got more reason than a lot of people to hate. We do. It's just not in us. I truly believe that. That's the African in me that lets me know hate is not my orientation. Love is. So whatever I can do in whatever capacity I've got, I'ma love you. I'ma love you as best I can. So to my people, I love you. I truly, truly do. I honor you. I respect you. I try to uphold the values, the true values of Nigeria, right? The true values of the Yoruba, my people, our people. It's worked so far, so I'm gonna keep doing it. But thank you all for this time. It truly has been an honor. Kunle, thank you for reaching out and making this connection. Try not to get too personal here, but oh, here it comes. The last time I went to Nigeria was when I was 10 years old. So it's been, over 25 years since I've been in my homeland, right? And now I wasn't born in Nigeria. I was born in the United States, but again, Nigeria means a lot to me. And I'm not naive about the challenges of that country, but oh God, I hope that sooner or later I can go home. I truly, truly do. I want to go home. I want to see my grandma. I want to see my cousins. I want to see my auntie. I want to be home. I really, really do. And show them and show the sacrifice that my father made. It's incredible. He left Nigeria at 21. I couldn't imagine leaving my home at 21 to start a new life. And he did. And that new life included me. So I do this for my father. I do this. I know he has his issues with Nigeria. He's real. I get it. But it means so much to me that he did what he did and helped me to be who I am. My sister as well, who's the smarter one of us too. But she became a medical doctor. So, he loves that. But it means so much for me to be in this space around my people. And yeah, one day, right? One day I'll come home. So thank you.
One day. Thank you so much. Thank you so much. Honestly, what you said touched so many, touched me personally on so many levels, right? Being of mixed race, there are some experiences that I hear that I cannot imagine. I can't. And when you talked about listening, I realized, just like I listened to you, to be able to connect with what it is that you do, and what you do is phenomenal. And then the rhythm of the drum, regardless, it's that's something actually that gets people together. And lastly, the picture of equity, I've only ever seen it up to equity. Do you know? You've seen, and they're all standing on different, but I never saw it to liberation. I love that image. I'm going to look for it, because in many ways, we all, regardless of where we are from, we need liberation. Thank you so, so much. Please, can we give him some emojis of love and appreciation?
They're giving me plenty. Y'all giving me plenty. I appreciate y'all.
And one day, you know what? You will come back.
I know.
You will come back, and I hope that we get to meet you, your fabulous self, your fabulous family. Thank you so much. Thank you.
I appreciate y'all.
Okay. Din, 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 din. Time is ticking away, and now we have to move on to something that's actually also very exciting. Ding, 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 ding. Our virtual exhibition is live, and for this I want to introduce to you the beautiful, dynamic, hardworking Ashley Stewart. let me read you her bio. Ashley Stewart is a multidisciplinary visual artist, independent curator and educator at the Department of Fine Arts and Design in the University of Port Harcourt, Nigeria. Her academic accomplishments include a BA Hons in Fine Arts and Design, 2 diplomas from the London Academy of Media, Film and TV, and 2 master's degrees in international management obtained in the Loughborough University, UK, and Fine Arts Department of the University of Port Harcourt, Nigeria, respectively. She is a British Council Study UK Alumni Awards finalist for Culture and Creativity 2022 and Design Management Institute Student Essay Winner 2022. Ashley is an accomplished leader and is a board member of the Arts Council of the African Studies Association, West Africa, coordinator in the Global Arts in Medicine Fellowship alumni, that's how I met her, and on the International Communications Association Nigerian Executive Board. She's also a member of the National Arts in Health Week Planning Committee. Over to you, Ashley. What do you have for us today?
All right.
Could you unmute?
Okay, thank you very much, Yinka. Oh, wow. And thank you, Dr. Fake and all our presenters. Thank you so very, very much. Very moving presentations. So I would like to introduce our exhibition. The theme is Art and Inclusion, Autism and Sickle Cell. You're all very welcome. This exhibition explores the intersection of autism and sickle cell conditions through the lens of arts. Did you know that Nigeria has the highest case of sickle cell in the world? 1 out of every 4 Nigerians is a carrier of the sickle cell gene. In a 2014 study, it was observed that over 4 million Nigerians may live with autism. The WHO, the World Health Organization, states that 1 in every 100 children worldwide may be living on the autism spectrum. This exhibition, using art as a tool to communicate stories and share various perspectives on autism and sickle cell, will create more awareness for these conditions and hopefully raise funds for the work that the National Arts in Health Week does through the Arts in Medicine Fellowship. In a bid to create understanding of autism and sickle cell, talented artists from around the country created works, which you will see shortly. This unique showcase aims to foster understanding, empathy, and dialogue surrounding the conditions and shed more light on the individual experiences of the sufferers or warriors, as we call them, their families and caregivers. Our curatorial team shortlisted over 38 works from neurodivergent and non-neurodivergent artists from a pool of entries. This is a transgenerational exhibition with the oldest exhibitor about 50 years old and the youngest at 17 years old. Each work of art is a unique story in itself. It is our hope that this exhibition creates a more inclusive and diverse society where everyone, every ability, and every experience matters. So happy viewing. Please cue in the exhibition. Thank you. All right. This work you see here is titled Blue Eyes by Olaleye Abdullah. This work is a pencil realism with clear mastery by Olaleye. The eyes, they say, are the windows to the soul. This dominating stare by a boy who could be autistic gives a calm but relaxed feel. Although autistic people cannot make eye contact, staring into the soul of this young boy could be the confidence he needs. Blue is the color for autism awareness. Please to the next work. The next work that's coming up is Helping Hands. Helping Hands by Emmanuel Umorin. It also adopts the color blue for autism awareness. This beautiful work shows that we all need a helping hand, a guide, and support. This painting shows two hands, an older hand from above and the younger hand from below. Here we see trust. It says, yes, I will help you. And yes, I will go with you. What better way to navigate life and your conditions or any other challenges than with a helping hand? The next word, emotions. Emotions is by Betiang Amadeus. Emotions is a sculptural installation of the various moods encountered by people living with both conditions. They aren't different from everyone else, and this piece is a reminder of that. The next work beside it that you can see is by Favor Abere. It is titled My Ability. It has been scientifically proven that autistic people play musical instruments very well. A young boy is in his own world and he draws you into his world in such a melodious way. His concentration is inspiring. Our next word, again. Again is by Okota Chibike. Again, it's a moody piece showing a warrior in remission. She is clad in traditional wrapper to keep warm while contemplating on the need to be injected again. If you move closer to the work, you will see some syringes on the table over there. This painting is a familiar experience for warriors and their caregivers. Next, we have amniocentesis. Yeah. Amniocentesis by Ezekiel Osondu depicts a child in the womb undergoing a prenatal testing for sickle cell. We can see how crude it looks, but that is the reality of some pregnant women. So far, a lot has changed, and early detection can be done through various testing ways. Our final piece for today is Red. Red is a sculptural metallic piece. It is the man holding a red heart. The heart is out, and he is holding it proudly saying, I am alive. Here I am an overcomer. So these are some of the interesting works we have on display, and will run till Sunday, the 14th of May. Please use the link which will be provided to you to enjoy the works on display, to make purchases if you want, and to support our community. Thank you for your time.
Thank you so much, Ashley. I loved all the works you highlighted. Such a brilliant work. Such a brilliant exhibition. I think we can run it for a month. Okay. So 14, yes. So that the artists themselves may have the time to go there and see what they've done, and then also share it with their own friends. So you and I, we got this.
Yeah, man.
Thank you so much. Thank you. Mwah. Okay, as we say bye to Ashley, we're going to say hello to somebody else, and we're going to say hello for our closing remarks. Now, I want to say that we have two sections. This one ends after the closing remarks by Teresa Salami. We also have in the house Veronica Gould, and we have a section for some more time for arts in brain health, I believe. Yeah. So we have Veronica Gould, who is coming to speak to us from the Arts for Dementia in the UK, and she's going to be sharing with us, you know, how the arts help in mental health, in brain health, and exactly something that is very interesting and very needful, seeing how dementia, Alzheimer's, and everything else that that happens in the brain is it seems to be advancing, or it seems to be, I don't know, maybe it's just because that's what I personally am more interested in. But anyway, I just wanted to say, okay, so perhaps, okay, we are, okay, I think I will just introduce Imal. Sorry, just give me a few. Okay. Oh dear, just sort of caught off guard with the change in the program. So please do bear with me. Do bear with me. Damola, would you want to say something, a few words while I okay, Imal, is she here? Imal, okay, yes, he is. Okay.
I am.
I'm looking, I'm fishing for your bio, actually. I'm so sorry. I thought I haven't printed it out. So
proceed.
Please proceed.
Let's proceed.
okay, or do you want to just go ahead and introduce yourself?
Okay. Well, let me just all protocols observed. Thank you for, well, first of all, I need to apologize for joining a bit late. I was on the road and I was reporting traffic. I also want to thank Kunle Adewale for this huge commitment and sacrifices made to make this platform possible. So I don't get the opportunity to share that publicly, and I want to do that right now. I also want to thank the distinguished speakers, as well as all the ladies and gentlemen attending, for being part of this significant movement. You know, I'm an artist, and I'm also an entrepreneur. I actually am an investor in healthcare, serve on the board of a hospital. Well, we manage several healthcare facilities. So it's an interesting position to be in, especially, you know, when one looks at the National Arts in Health Week and all that is happening, because I'm actually smack in the middle of both fields, both the creative industry as well as the healthcare industry. So I don't need to say more than that as regards my bio, but I just wanted to leave us with, I'm supposed to give the closing remarks, and then I want to leave us with a few thoughts. You know, I've always had a problem with the definition, not because it is not true, but because I did not see us doing what it professed. And that is actually the WHO, you know, definition that says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. You know, for as long as I can remember, I always look at this definition and I see, okay, when it comes to the physical, yes. When it comes to the mental, yes. But when it comes to the social and even, you know, mental, I always felt we hadn't done justice. You know, so when I was invited to be part of the National Arts in Health Week and to serve on the board, for me, I saw it as the first time that we could actually do justice to this definition, because we're actually taking the areas that weren't really the areas of focus as it should be, and now we're actually doing something about it. So for me, it's a very personal and fulfilling experience of being part of the National Arts in Health Week. I think that in closing, I would like us to look at the opportunities this brings, the very platform of the National Arts and Health Week, as well as the other programs. I think it's a fantastic opportunity for all of us to plug into something new, to plug into what I would call the next level, of healthcare, and as well as see how we can improve the health outcomes. So I wouldn't want to say too much. It is, I will leave us with two questions, and one, one question is, how can we be accountable to the truths we are going to be exposed to today and the next few days? And what can we do to make an impact in our own localities and in our spheres of influence? So those are the two questions I want to leave us with. Let me say it again. How can we be accountable to the truths we are going to be exposed to? And what can we do to make an impact in our localities and our spheres of influence? Thank you, and may God bless the works of your hands. Thank you.
Thank you so much. I think she's got, oh, okay. There was a little bit, but can you guys see me? Okay. Thank you so much, Mr. Imal Silva, for who is actually one of our board members, for that really interesting closing remarks. And he really just touched on what this opening ceremony has been about, and really has been about expanding the definition and understanding of what health looks like, so that we are working with that expanded definition and putting back health into the spaces that it should be targeted and looked at and encouraged. So thank you to everyone. Thank you to all of our speakers that have spoken so far in the opening ceremony. So we're kind of at a stage where we are transitioning from what is our opening ceremony. So I want to say thank you again to Mr. Imal. Thank you to Dr. Oh, he's left. Dr. David, who has left already, but thank you so much. That was really, really fascinating, touching, just moved. I was moved. I have to say a couple of us were crying. And thank you to just everybody who has partaken, participated, spoken, commented in the opening ceremony. So as mentioned, we are transitioning from this part of today's session into art and brain health. And so I'm going to pass over to Yinka, who I think can now chat. Okay. So
yes.
Okay. So
thank you. Welcome to the part where we're talking about art in brain health, and we have with us the spectacular Veronica Gould, and I'm going to read her bio. So, and there she is. Hello, Veronica. We're so happy to have you.
Thank you.
Yeah. Veronica Gould is an art historian and biographer. She was curator and organizer of the centenary exhibitions of the Victorian artist J.F. Watts and his wife Mary Seton Watts, the Watts Gallery 1998 and 2004, and of the bicentenary exhibition of the Victorian Poet Laureate Alfred Lord Tennyson at Farringford 2009. She conceived the idea for the Art for Dementia in 2009 when a young Russian cellist Studying for an MA at the Guildhall School of Music and Drama, performed Bach for her mother, who had been diagnosed with Alzheimer's disease 7 years earlier. The high quality of the music and the musician's understanding and eye contact aroused the return of her natural communication. Her interest in the musician's career prompted Veronica to research artistic stimulation that bypasses dementia symptoms. Her A4D partnership programs with arts ventures around London, Life Transforming for Families Affected by Dementia, have won the London 2012 Inspire Mark, the National Breakthrough Positive Practice in Mental Health Dementia Award in 2013. She was named Sunday Times Changemakers, a finalist in 2014, and achieved NIACE Adult Learners Week Highly Commended in 2015. Veronica was Chief Executive of A4D from its inception until the 30th of September 2015. During that time, she achieved an extraordinary amount for the charity. She built up a board of trustees, advisory panel, and patrons to encourage the development of careers and opportunities for wide-ranging artistic stimulation. Amidst the research, fundraising, amidst the research, fundraising, conference planning, negotiations, working with interns and volunteers, her pilot projects first at the Wallace Collection, Poetry and Communication at Putney Library, a music partnership project with Live Music Now, Kingston University, and Age Concern Kingston, revealed evidence of memory retrieval and joyful, enriching transformation as people rediscover their voice and memory through our talented young musicians and course leaders. This led to an A4D's London Arts Challenge in 2012 program of 18 weekly projects at art venues around the capital, covering art, dance, drama, music, photography, and poetry, and inclusion in the 2012 Inspire program. Her resulting evaluation, Reawakening the Mind, was described by Baroness Greengross, chair of the All-Party Parliamentary Group on Dementia, as a very important report, and by Professor Paul Kamick, Professor of Psychology and Public Health at Canterbury Christ Church University, as a world first. And on that note, Victoria, it is an honor to give the floor to you.
Unmute. Still says I'm not muted. Can you hear me? Can you hear me now?
Yes,
Oh,
you're unmuted.
okay,
We can hear you now.
Brilliant.
Yes.
Thank you so much. And it's such an honor to be invited to talk for National Arts and Health Week Nigeria. As exemplified by the expansion of arts in medicine, these are really exciting times. So I'm really going to speak to you about the situation in the UK, but we have been running a whole series of global debates, and I'll give you the link to that at the end. But the NHS introduction of social prescribing link workers in the UK, available to every GP, means that earlier than ever before, as symptoms of dementia arise, people can be referred to life-enhancing cultural and creative activity that can empower them to override the strain and preserve their brain health and resilience in the community for longer. I hope this communication can be adapted in the context for Nigeria. I'm just going to show you my PowerPoint and hope I'm going to get this okay for you. Here we go. Right from the start. There we go. So this paper will open with a brief introduction to dementia, the challenges to patients as symptoms of mild cognitive impairment or an early stage dementia set in, the patient experience from GP to memory service and diagnosis, the historic context of arts for health, the introduction of the social prescribing and its role and application with reference to the NHS Well Pathway for Dementia, as illustrated, and this is really where I think it'll be of most help. As illustrated in our Arts for Dementia report, arts, that's arts A.R.T.S, actually it's all embracing activities to revitalize the soul. Arts for brain health, social prescribing, transforming the diagnostic narrative for dementia. And then I shall finally touch on the social prescribing champion scheme and how students can benefit through sharing the lived experience of arts workshop programs for brain health. So this is the Well Pathway for Dementia I mentioned. It goes through the 5 stages. I'm particularly concerned with Prevent Well.
Are you sharing your screen? Because we can't see.
Can you not see it?
No.
Oh, sorry, I'll go back. Sorry, it looks to me as though I am sharing it, but hang on a sec. Let's go. So, I'm so sorry. I'll start again. I'm out of that. Share screen. Let's go back onto the. Sorry about that. Share screen. Share screen. So I've got too much on the moment. Let's have a look. PowerPoint. That's it. And then we'll. Now, can you see all well? Are you seeing it now?
Yes, thank you.
Brilliant. Sorry about that. So this was, I was telling you about the arts of brain health, social prescribing, transforming the diagnostic narrative for dementia. Actually, do you know, I just want to tell you about that picture, which we're looking at on the screen. This picture I commissioned actually to show how taking up arts can preserve brain health. And it is a dual profile of the same person, one frightened by the diagnosis on the left. This can actually refer to other diseases, not just and conditions, not just dementia. But the one on the left is frightened by their diagnosis, and the one on the right, enchanted by taking up arts. And you can see the various musical instruments, the dancing bird, the singing, and the declaiming, and then the upside down trees to show you the variety and to stimulate thoughts. And so the arts head is extending a hand of empathy to the diagnostic head, while the diagnostic head's other eye bravely swims over waves of dementia to take up the arts. So here we have the Well Pathway for Dementia, and it begins with preventing well, and that is the most important point, and living well that we're talking about. So here we are. Each year, there are over 10 million new cases of dementia. Later on, but I want to say it right at the beginning. I try very hard not to use the word dementia. When we founded Arts for Dementia, that was the right word because nobody really knew that arts were helpful for dementia, as indeed they are for so many revitalizing people with any condition, notably arts in medicine. So it was the right name at the time, but I would, if I were, I would rather it were now called Arts for Brain Health. Most people know that brain health, it refers to, even though you can have tumors and things, tends to refer to dementia. And so where possible, it is less stigmatizing to talk about preserving brain health than doing something for dementia. So here we are. Each year, there are over 10 million new cases around the world, set to triple by 2050. In West Africa, the prevalence is fortunately lower than other areas of Africa. And I'm afraid I couldn't find out the figures in Nigeria. I tried really hard, and you probably know how many cases there are of dementia or the condition in Nigeria. But dementia, we're just calling it that for the moment, progressive degeneration of the brain with no cure as yet, is a frightening condition whose stigmatizing name is a deterrent. Early symptoms of a potential dementia vary according to the dementia type and the individual. Alzheimer's disease is the most common. Caused by damage to the temporal lobe, it begins gradually with mild memory loss, some confusion, forgetting names and where possessions have been left, difficulty finding the right word, reasoning, following, conversation. People may become more withdrawn and experience mood swings. Vascular dementia is caused either by stroke or by poor blood supply to the subcortical deep parts of the brain. Again, there is confusion. People may become depressed, anxious, not necessarily suffer memory loss. Damage to the occipital lobe may affect vision. I just want to say one thing quickly, that in a recent program, well, in 2020, a participant who'd been diagnosed with vascular dementia following a stroke was attending art classes, and she attended drama with us. And when I was checking for the report, how her diagnosis had been, I wanted to find out where the challenges were in timing, etc. She said, "Oh my dear, I haven't got dementia after all. I can now read again. My memory has come back, and my condition is now reassessed as stroke damage." And this is because she'd been taking up, regular arts activity. So when we're talking about arts activity to re-energize people and help protect against cognitive decline, it really, really does work if you have this regular weekly activity. Anyway, we'll go on for the next one. So Lewy bodies, dementia with Lewy bodies. These are tiny deposits in the brain's neurons, nerve cells. They bring symptoms similar to Alzheimer's and to motor problems associated with Parkinson's disease. Among the many symptoms, unfortunately, hallucinations and delusions of persecution can be distressing. Then frontotemporal dementia, caused by damage to the brain's frontal lobes, affects behavior, emotions, and may lead to inappropriate and aggressive behavior, even in mild-mannered people. Frontotemporal dementia is likely to be diagnosed at a younger age, between 45 and 65. So with no cure or even support until diagnosis, all would benefit from protection against the isolating strain at the outset of symptoms, through participating in arts to preserve their brain health. It is advisable now, this is where I've got to, but I don't mind repeating it because it's so very important. It's advisable now, rather than use the stigmatizing term dementia and the passive arts for dementia, to refer to brain health, preserving brain health, as exemplified by the Global Brain Health Institute, where a participant stressed that she would prefer people to refer to her condition not as dementia, but as brain disease, like heart disease. Remove the stigma, accept the condition. In 1948, the World Health Organization, in defining health as a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, as we've just heard, rooted health firmly within society and culture. That same year, 1948, the year of my birth, the Universal Declaration of Human Rights, the first international agreement setting out freedoms, rights, and entitlements for all humanity to claim, still stands today, declared that everyone has the right freely to participate in the cultural life of the community. Yet, for many people in the lonely, fear-filled months awaiting memory assessment, the right to arts participation has been hard to access until now, or I should say until social prescribing. We'll cover that in the UK, but great things can happen in other parts of the world. In the UK in 2019, the NHS long-term plan introduced social prescribing link workers available to every GP through their primary care networks to provide psychosocial support for their well-being. The link workers' role is to find out what matters most to individuals and their family partners, their interests, to work together on a plan and connect them to local social activities that particularly appeal to them. Thanks to surgery-based social prescribing in the UK, arts can be offered at the onset of so doing and onset of symptoms, and in so doing, transform the diagnostic experience. relieve fear, and open the door to social, cultural, and creative activity. Here today, we should like to raise awareness that even without link workers, or until they are introduced in Nigeria, your close-knit communities who may already look after their elders, like the storytelling basket weavers in Kenya, for example, the creative activity in such communities can do much to protect against or slow cognitive decline. So I've explained the wide-ranging arts to include activities such as visual arts, music, dance, drama, heritage, nature, Indian dance, everything, anything that's revitalizing and joyful and engaging. Choosing arts of personal interest empowers both the individual and their partner to address modifiable risk factors, combat stress, reduce isolation, preserve sense of identity, of purpose, of belonging, so that peri and post-diagnosis, their resilience in the community can continue for years. I shall now outline our report, Arts for Brain Health. I was telling you about that one, Social Prescribing, Transforming the Diagnostic Narrative for Dementia from Despair to Desire. So it's structured on the UK's NHS Well Pathway for Dementia and informed by 400 experts in dementia prevention, creative aging, social prescribing, culture, health and well-being, people with lived experience, GPs, memory services, local authorities, and psychiatrists. It examines how arts address modifier risk factors for dementia and protect against cognitive decline. The current diagnostic practice with case studies from patients and how GPs and memory services offer or plan to offer social prescribing. Then we've got examples of social prescribing, creative aging, and arts for brain health. And models for collaborative practice, so important for arts organization to raise awareness to social prescribing link workers and achieve sustainable arts programs. So starting with preventing well, arts modifying risk factors. As a third of cases of dementia could be prevented, risk factors and how arts protect against the advance of dementia are examined. For example, learning versus lack of education, learning music, poetry, or drama, exploring artworks, challenges the brain to create new neural connections and pathways that can compensate for reduced activity in other regions. Opening the door to new discovery and engaging interest is the essence of cognitively stimulating arts. Co-curating heightens the sense of identity, purpose, and connectivity as members of a resilient, socially active group. Social contact versus loneliness and isolation. Social connectivity plays a vital role protecting people at this vulnerable cusp across all social backgrounds and cultural ethnicities. Arts fulfill their core psychological need, nurture social bonding, personal identity through collaborating in creative endeavor. Dance movement versus physical inactivity, obesity, and depression. Dance offers a joyous route to health and well-being, more effective than exercise alone in reducing body fat, fall prevention, and through music in improving mood, reducing stress, and helping to maintain attention. Learning new steps to lead and follow enhances coordination. Music versus depression. Music making provides a vital tool for a total brain workout, improved plasticity in the cortex, which enhances the aging brain's cognitive abilities, perception, motor function, working memory, and improves cardiovascular strength. Music allows creative self-expression, reducing stress, and giving a joyous sense of accomplishment. Connecting actively with nature versus physical inactivity. Group activities for well-being and camaraderie in nature help protect against obesity, sleep deprivation, anxiety, depression, and social isolation. So diagnosing well, the patient journey. It can take years from the start of symptoms to get a dementia diagnosis. People often pass initial cognitive tests and may have to wait months for memory assessment. So GPs can help patients by referring them to a link worker for art support at the onset of symptoms, or I should say anyone who knows that person, to suggest arts as soon as these symptoms arise. It would be really helpful to recommend them, to refer them and recommend them to local arts activities. Memory services are now beginning to advise patients awaiting appointments to take up arts. Supporting well the social prescription. Link workers give quality time to discuss patients' and partners' non-clinical needs. Supported by regional learning coordinators, they research local psychosocial sources of support, such as arts, and can refer to our Arts for Dementia social prescriber directory, and now the new Prescribe Arts website too, for workshops and events by art form and postcode around Britain. And yes, and as we said, and today ESOP launches, has now launched their Prescribe Arts website. If what the person wants to do doesn't exist locally, link workers may have access to a community builder who can support its setup. That is actually very exciting. And for individuals needing companionable support to access arts, we coordinated Arts Pal, a regional and cultural and creative befriender network. This is a really good idea to do that, because if you can go with someone, if you live alone and can go with someone, it really makes it much more fun, much more normal to enjoy and benefit from the arts. So living well, arts to preserve brain health. Arts for creative aging to nurture resilience of individuals and their partner. Run by arts organizations, community arts hubs, heritage organizations, healthy living centers, men's sheds, nature and active organizations are detailed in our report. These are weekly participatory activities designed to re-energize and inspire, with arts teams trained in the challenges of mild cognitive impairment. Whether or not the diagnosis is dementia, participants continue to enjoy the group, co-curating, improvising, inspiring each other. Inviting arts, medical and social care students to volunteer and interact with arts workshop participants aids early career understanding and dissertations and future arts for brain health practice. You will have heard from Bogdan of the Global Social Prescribing Student Champion Scheme. In the UK, students have been attending weekly arts workshops for a term or more. They interact with participants experiencing early symptoms of dementia and their companions, assist with evaluation and actually this is really, really helpful because in the medical curriculum, they don't really cover early stage dementia. They go sort of straight into the challenges of dementia, but you know, it doesn't happen wham like that. It happens gradually. And as one student reported, I was inspired by the participants' boisterous and social demeanor. Their creativity and imaginative ideas encouraged me to think outside the box. Different personalities were able to interact and collaborate together. It was exciting to see different perspectives and learn more about each other every week. And working with such a vibrant and enthusiastic group taught me a lot and enabled me to bridge the gap between medicine and the arts, and between health and the early symptoms and the moderate symptoms of dementia. So a key learning point for students and professionals alike is that to offer arts prescriptions as early as possible in the dementia journey provides a vital lifeline to culture, creativity, maintaining and discovering new interests joyfully together. So the way forward. For sustainable arts, our report highlights the UK National Academy for Social Prescribing's Place-Based Thriving Communities Fund, a cross-sector partnership model ideal to raise awareness and funding for sustainability. Now, they're not continuing the fund as it was, but they and the Arts Council are promoting shared investment. And I think this must be the way forward for arts, like arts in medicine, for arts and the health sector to work together to involve all stakeholders in any program you put on, and that attracts the funding you need for sustainability. And what I would propose is that in each of these workshops, the re-energizing arts activity, that these tie in with university terms, let's say 3 terms of 8 weeks each, and they run throughout the year. And so you don't leave participants stranded at the end of the year, and many students can have advantage of working with you. We are working towards a 3-year research study to gather data from these weekly arts workshops to ascertain the actual evidence as to whether health and care needs are lessened as a result, providing exciting landmark evidence, possibly starting next year. I would like to say that pure observation, when I first started Arts for Dementia, I noticed that people could stay with these re-energizing activities for about 3 years. And then they would need more relaxing, like singing for the brain. But it was interesting that Henry Simmons of Alzheimer's Scotland said the same, happened to mention 3 years too. But let's hope this study will provide actual evidence. And thank you so much for inviting me to speak to you today.
Oh, Veronica, I wish you could still keep speaking. You are such a wealth of information. I mean, my page is full, and you're so right. You know, we were having a discussion. I mean, I don't want to waste any time about, you know, it was like about 5 years ago, I learned that dementia actually starts at a young age, but it's not obvious. It doesn't manifest until later on. And also when I started trying to do studies or courses on the gut-brain axis, how what we eat actually also helps, you know, to fasten dementia or to reduce the onset of it. And when you're speaking now, yes, definitely the arts, especially music. My mom, who is 80, actually she responds so well to music. And so thank you so much for this beautiful, beautiful session, Arts for Brain Health. Yes, we are grateful to have you. So everybody, let's share some love hearts for Veronica. Let's share some love hearts. Let's share some appreciation. Thank you so much.
I just want to tell you a little postscript, because I really know how much music makes a difference. I've just been singing in Rome. We were singing The Dream of Gerontius, and with the Parliament Choir, sort of hundreds of voices, and it makes you feel exhilarated. And it's that exhilaration we want to give people to help preserve their brain health. And those, you know, and whatever the situation about social prescribing or whatever, if there are people locally, and I know how in Nigeria you really do care for your elders, you know, that groups can be got up and really serious, you know, to encourage whatever the local craft is. It is exhilarating and wonderful. Anyway, sorry, I shouldn't tell you about that, but
no, you're right. You're right. Absolutely, how we take care of our elders. Part of this this National Art in Health Week, we're going to an elder care home on Friday to have a creative engagement with music and the arts as well. So we definitely know it's for them now. I guess it's also awareness, creating more awareness, and just, you know, like social prescribing has been launched here. Also introducing that to but it's mostly advocacy and awareness that we need to have over here anyway. Yes. But we're blessed. Thank you so much.
Thank you very much. Thank you.
Okay, so I think we're about to wrap up. It's been, as far as I'm concerned, I'm not biased, but I have learned so much. It has been such an engaging, educative, but also, how will I put it? Great to know knowledge, gaining knowledge and learning experience, for at least for myself, I think for everybody here. And at this point, I think we want to almost call it a wrap. So I think, Oyinda, do you have any few words to say? No. So I'll hand it over to our dearest three men. Mr. Adewale, you're going to teach me how to pronounce this thing, Ojari. Do you have something to say, Mr. Adewale, before we call Toyin for the closing and thank you?
Definitely. I would love everyone here to celebrate the committee members for such an incredible opening ceremony today. Please, let's celebrate them from our chair, Oyindamola Fakeye, to Tinka Enaro, Okurumeta, not Okurumeta.
Sorry.
Okurumeta, not Okurumeta. All right.
Oh, occurring matter.
We'll have that Yoruba class later. Yeah,
Okay.
and just to say a very big thank you to our amazing committee members for such a brilliant opening ceremony today, and most importantly, everyone who have actually joined us today. I mean, without you in this room today, it would just be an empty room. So please applaud yourself. Applaud yourself, everyone. Thank you for joining us today. Thank you so much. And to our amazing speakers today, starting from the keynote speaker, Dr. Bogdan, for such an inspirational work and sharing on social prescribing. That for us was very moving, a very, very moving experience. So I just want to thank you. And again, joining us again today is the amazing team from Jami Art and Health Lab. We have Dr. Nisha Sanjadani. Thank you so much for joining us. And also from WHO team as well, Christopher Bailey, who's also in Lagos, Nigeria. And definitely many of us who are in Lagos will get to see him and Dr. Nisha on Thursday. Also a very big thank you to Dr. Fakunle David, who's my namesake. It was very amazing. You know, while he was talking, I was very emotional. I was kind of very teary. I was crying as well. Oh man, it was very, very moving. Very, very moving. And thank you so much for that as well. And thank you to also Sir Imad Siva, who's one of our board members for the National Art and Health Week in Nigeria, who was able to give us a word of encouragement. And to our last speaker today, who I called Mama V, Veronica, thank you so much for that wonderful presentation art for brain health. And just like Chris said, that, you know, it's good we use the language right. Rather use the word art for dementia. It's better to say art for brain health. And in the closing today, just to say a very big thank you, and looking forward to a bright and beautiful, stronger, better, brighter art and health engagement in Nigeria, as it's spread across in Africa and across the world as well. Thank you so much.
Thank you so much, Mr. Kunle Adewale. Thank you so much. So over to you, men, three men, my super T. Honestly, I love this woman. I tell you, she's just amazing. She is amazing. And is this fellowship that brought me together with her, and I love her. I love you. Anyway, continue. You're just amazing. Everybody is amazing.
Thank you very much, Inka. First of all, I'd like to thank everybody for coming on. Definitely on this side of the divide, coming on to a virtual program has reached his sometimes his limits since COVID. But I want to express my thanks for you taking out your precious time to come and listen. And I hope you've been able to take one or two things. One thing I always say when I attend programs is not just to listen, but to take what we have learned and put it into action. With this, I'd like to thank Dr. Bogdan for his speech. on social prescribing. In fact, when I heard this, my mind blew because I'm working on a project, healthcare project, and I thought, wow, this is something that can be used. I'd like to also thank Dr. David Fakunle for his talk on public health, and community health, and policies. And also, finally, I want to thank Dr. Veronica Gould for her talk on brain health, and for everybody who has played parts among way and the other, including Mr. Imal Silva for taking the closing remarks. I just want to use this opportunity to say that arts in its whole entirety has an impact on the mental and the physical health of a human being. And it's something we shouldn't take for granted, whether we're artists, whether we're medical people, or whether we're just people who love to sing, dance, whatever it is. Let us use art as a way to connect with each other and to break every challenge regarding stigmatization, discrimination, tribalism, and all the conflicts that we generally have in our society today. Let us use it as a way of bringing people together, and let us unite to create creativity. Thank you, and God bless you. Please don't forget, we have a physical program on Thursday. Check our website and register for it. We look forward to having you. Yeah. Thank you. Have a nice day.
Thank you so much, Superwoman. Yes, Mr. Kuli has shared some links in the chat. So our virtual exhibition is going to be up for about a month. Yes, it will be for a month. And perhaps we'll even add some more things, but so far, so good. And also the links to our program it's a hybrid actually, but it's also virtual and physical on Thursday, the main conference, where we're looking forward to a retinue of amazing speakers just like today. I can't wait personally. And we also have orchestral performances, we have some dance. I don't want to give too much away. All I'm going to tell you is that you gotta be there, or be square, they say. But no, we're not square here, are we? Anyway, so finally, I want to give the floor to our chair, Oyindamola Fakeye, to say one or two more things.
Thank you so much. Again, this has just been such an amazing afternoon. Thank you for staying with us for 3 hours. We do not take it lightly that you have given up your time this afternoon. Today, really, the last session with Veronica closes out today's programming, and today was actually focused on social prescribing activations in Nigeria. Over the next couple of days, we have different focuses for each day. So tomorrow we'll be focused on art in mental health spaces in Nigeria. And we will be visiting the Child and Adolescent Mental Health Center in Oshodi. And then we will be having a co-musical experience with patients at the Federal Neuropsychiatric Hospital, which will be led by the wonderful singer Simidele Adebisi Jafojo, who you actually saw in the clip that Mr. Kunle shared, who was previously a patient and who is now part of our team on Arts in Medicine, and also Peter Oluwadare, who leads the Arts in Medicine Orchestra. On Wednesday, it's Arts in Pediatric and Public Health. We will be doing visits with the National Sickle Cell Center, and also there'll be a workshop run by TAOH, T-A-O-H, which will be facilitated by the artist Nengi Omuku. And we also have another workshop which will be facilitated by Julius Agbaje at the Lagos University Teaching Hospital within their pediatric and pediatric oncology units. From Thursday, as mentioned, we go into our hybrid programming. So we will be having a conference which is focused on strengthening multi-sector partnerships for arts, health, and well-being in Nigeria. So we'll be focusing on arts, workers within the arts, health, education, and government sectors. Please do sign up. The links are in the chat for you to sign up. If you're not in the country, but you want to join virtually, there's links for you to join and follow that conversation. And also Thursday, we kick off our in-person exhibition, which will be held at the Children's Art Gallery in Lagos. On Friday, as Yinka mentioned, we will be doing sessions with the elderly home. Yeah, we're looking forward to that multi-generational engagement. We're also inviting Art in Health. We're also running a program, Art in Health, in tertiary institutions on the Friday afternoon, where we will be engaging with within the education sector and encouraging them to think through how they can also be prevalent in the conversation. And then we encourage you all over the weekend to get out, to go visit arts exhibitions, explore your city, engage, connect. Our theme is art and human connection, uniting through creativity. And I love what Veronica mentioned, that it's nice to have an art palette. It's nice having other people to do these things. Why not invite someone that you haven't spent much time with recently, or just someone who fills your love tank as well, and get outside, explore your city, engage with some art making. And on Sunday, we have the closing event, which coincides with the Global Arts in Medicine Fellowship closing. And it's your opportunity to see what fellows from around the world have been doing in the arts in medicine space. And it's opportunity also for those who are interested in joining the next cohort to learn a bit more about that. So we've got a jam-packed week, and we are looking forward to engaging with you further as the week goes ahead. We'll keep this the chat open for a little bit so that links can be shared. If I can see a few questions coming in the chat, but can I ask? We'd really love to do a group photograph. So could I twist some arms and ask people to switch on their cameras so that we can get a group photo? I also wanted to make sure that I thanked another member of our planning committee who is on the call, Emilimo. Are you still? I hope she's still here, but just to mention her, because I know she's been in the chat as well, and she's been here with us all afternoon. She's been doing great work, and we want to just say thank you to her and honor her, and Mary as well, who formed the final members of our planning committee. So yeah, and seeing cameras come on, thank you so much. Thank you. Let's get as many cameras on for our group photo to mark register, as they say. Mr. Kule, will you help us